Good morning, everyone. Thank you so much for joining us. We'll get started here in just a few minutes, but we invite you in the meantime to take a few minutes to remind ourselves why we're joining the Learning Collaborative this morning. And we would love to meet you and hear about who you are and where you're coming from in the chat if you'd like to introduce yourself. Welcome again, everyone. We'll go ahead and get started and get slowly rolling here. Thank you for joining us for this morning's Learning Collaborative. We're so grateful to you for spending some time with us this morning. My name is Danny LaForest, and I'm the Workforce Development Manager at Greater Health Now. And I have the great joy of helping to plan these learning collaboratives. We are very excited to welcome you today for today's topic, perinatal care and maternal support, behavioral health resources for practitioners, patients, and community members. So as we were thinking about the topics that are relevant to our region and the concerns that the people we serve are facing today, this topic came to mind for us and is near and dear to our hearts here at Greater Health Now. And this is actually the first of a two-part series. So today we're going to focus on behavioral health related to perinatal care and maternal support. And in January, we're going to follow up with a part two about access to care more broadly. And that will include talking about our maternal mobile unit that Greater Health Now is working on. But we are so grateful for our wonderful presenters today. We wanted to acknowledge that this topic is unique to every person, everyone joining, and that there's no one right way to handle situations related to behavioral health. And so we are just grateful to you for joining and know that you will glean the information from today's topic that is most relevant for you and your organization uh, and take away what is your best path forward. So some of the things that we will be learning today. First, we're just going to talk about the general behavioral health concern that we see for within the perinatal pair. And the Pair G Fund will really be talking about their work related to that. And then we'll roll into learning about resources for practitioners, both here in the Tri-Cities and broadly across the state, to better support their patients' behavioral health. And then we're going to dive into some resources for patients and community members for immediate help with perinatal behavioral health concerns. So we have just a wonderful lineup of presenters today. I'm so grateful for this group, and I will kind of talk you through the order. So today we will start with Marielle Mendez from the Perigee Fund, and then we'll hear from Jamie Adachi from the UW Perk Center, Victoria Cherniak at the Perinatal Support Washington, and then Alma Pena Taveras from the Perinatal Collaborative of Benton and Franklin counties. So it is my great pleasure to introduce you first to Marielle. Marielle Mendez is a philanthropic leader, system strategist, and advocate for families whose lives, cultures, and strengths have too often been marginalized by traditional systems of care. Born and raised in Moses Lake, Eastern Washington, she brings a deep personal and professional commitment to immigrant communities and is a strong advocate for immigrant rights. She currently serves as a program officer at Perigee Fund, where she leads national grant-making initiatives centered on maternal, infant, and early childhood mental health, with a focus on culturally rooted, community-designed healing models for families impacted by trauma and structural inequity. Her work is grounded in a deep belief that families are the experts of their own lives and that healing happens through relationship, culture, and community. Marielle brings experience in policy advocacy, coalition building, and systems design, working closely with grassroots leaders, clinicians, doulas, community health workers, and parent-led organizations across the country. Outside of her professional work, Marielle is a proud mother, creative entrepreneur, traveler, and community builder who brings the same heart-centered approach to her family, cultural traditions, and creative projects. And with that, I am so grateful for you, Marielle, and I will stop sharing so that you can share your screen.
Righty. Good morning, everyone. It's so wonderful to be here with you all, and thank you, Danny, for that wonderful introduction. Can you all see my screen? I just want to make sure. Okay, wonderful. Well, Danny introduced who I was, so I'm Marielle Mendez, and I am one of many on our wonderful team. We span lots of different perspectives to the work that we do here at Perigee. And I will start my presentation giving you all a grounding of who Perigee is, why we exist, and then I'll move into why we care about maternal mental health and highlight some of both the national and state work that we do that is at the intersection of behavioral health integration, as well as some community and policy work that really spans a lot of the work that Perigee cares about, but also work that some of the other speakers will talk about today. So with that, I'll tell you all a little bit about Perigee Fund. We like to measure our years in child years. So we are turning 7 here coming up. And our birth story really is that our founder is a child psychologist who spent over 20 years taking care of families and realized that there are so many gaps in our systems of care, acknowledging the critical stage that is pregnancy to really age 3, and that first year being so critical for both the parent and the child. A lot of the research tells us that the most brain activity actually happens in those first 3 years of a child's life. But research also tells us that one of the most significant changes in the brain also happen to the parent brain and specifically the birthing person. And so Perigee was born out of this gap of we don't have enough systems that care about this really critical time period, not only for the child, the baby, but also for that birthing person and parents. And so so we're really grounded in the fact that these early experiences really matter for the brain development, but also for the way in which the child begins to learn how to trust the world And we know that babies don't exist alone. They exist within a relationship of that parent or caregiver. And so the mental and emotional health of that person is really critical for that development of relationships and the foundation for more longer term. And so really that is why Perigee is here today. And we think about this baby and caregiver relationship in the context of family, but the community also that surrounds that family, the programs that exist to support families, as well as the systems and policies that really trickle down to all of those different levels. And so the way that we do our work, really, our vision is ending intergenerational trauma. Again, we know that trauma is one of the most critical indicators of long-term effects. And so our vision is to ensure that we can end that intergenerational trauma through the power of those early relationships. Our goal is to support caregivers and infants' mental health and ensure that systems are valuing and embedding those very ideas into the way that work is done. And for us, the way that we do that is ensuring that mental health and relationship-based supports are more accessible for diverse families, especially those who are experiencing trauma or who are at higher risk of experiencing trauma. The second one is the momentum and capacity to address intergenerational trauma. We know that systems across the pregnancy to three age oftentimes don't know how to address trauma or how to prevent trauma. And so that's something that we really care about. And then lastly, families in pregnancy and early childhood have access to cash and cash equivalent benefits that reduce cumulative drivers of stress. And I will talk a little bit more about this when I get into the different types of grants that Perigee does, again, to support this bonding and stressors that parents are having to deal with, especially in those first 3 years. And across all of the work that we do, it's really critical that voices of families and families are really centered in that co-creation and decision making. So with that, why do we care about perinatal mental health? So as I mentioned, we see perinatal mental health and infant mental health as two sides to the same coin. And we know that when birthing people or mamas are not okay, then oftentimes that is an indicator that babies will not be okay if they are not supported by perhaps other support systems or forces that protect them from the impact of that particular person. We also know that perinatal mental health is one of the most common and neglected complications of pregnancy and birth. A couple of facts, and thank you to our UW folks for sharing some other important statistics. So perinatal mood and anxiety disorders affect up to 1 in 7 pregnant and postpartum people. We know that in particular populations, these numbers are even more stark. PMADs or perinatal maternal anxiety disorders are the #1 pregnancy and childbirth complication, as we said, and oftentimes they are the leading cause of suicide, especially in that first year. Perinatal mental health and substance use disorders, again, are the leading cause of maternal mortality. And a Mathematica study that was done in 2017 told us that it cost the US about $14.2 billion a year. And we know that that's about $32,000 per untreated mother-baby pair, and 53% of those costs are really in that first year postpartum. So again, that first year is really, really critical, not only in the impacts on the birthing person, the child, but also on our economic development as a nation and communities. And I'll go back really quickly. There was just a study, again, in Mathematica, did it at the national level in 2017, but they just did one in Vermont in 2023 that said for one annual birth cohort in Vermont, untreated PMADs could cost up to 48 million from conception to 5 years postpartum. So again, really thinking, as we think about those concentric circles and the way they impact families and communities, the economic cost of the impact of this is really significant, and again can have these generational effects, as we know that when families fall into poverty, getting out of that takes a lot of work and resources to support folks out of there. A couple of other impacts that are important for us to keep in mind is that 75% of those who do screen positive for postpartum depression actually never receive the treatment. So as we think about screening, but also what is possible, it's important for us to know that there's a pretty significant gap. We also know that pregnant mothers with a history of trauma are at greater risk for depression, anxiety, and PTSD. So again, thinking about these generational effects when one parent or mother baby dyad have a significant relational break, that can also have generational effects for the next, mothering or parenting generation. Again, I mentioned that suicide is among the leading cause of maternal death in that first postpartum year. And as many of us begin to think about how to have behavioral health integration, a lot of the feedback that we've heard is that oftentimes when that birthing person or that mom does not have external supports, whether it's from the father or the partner or some other family member, it's really difficult perhaps for them to continue in their care or even get access to the care. And so it's important for us to know that folks are starting to take stock of what the fatherhood or the partner experience is in all of this, and that they too oftentimes experience also postpartum depression or other mood disorders. And so some of these early facts are telling us that about 1 in 10 fathers are also experiencing postpartum depression with higher rates when their partners are also struggling. And again, these statistics look different for different populations. So what is a perinatal cascade? And Jamie Cannon will probably speak more to this when she talks about the work at UW. We know that, as I said, 75% of people who screen, but even then only 50% are detected. And out of those 50%, 15% receive any treatment, 7% are getting adequate treatment, and even then only 4% are treated to remission. And so again, as we're thinking about the systems that exist, we have to think about the entire process and where folks are entering the system, and those that do enter the system, where are we not perhaps screening them correctly? So thinking about the cultural approaches and the way that we are thinking about perinatal mood disorders, our screening tools, our workforces that are all part of the detection piece, but also the treatment and the continuity of care. And as I've mentioned before, perinatal mental health, we know that inequities exist. We know that folks who identify as Black, Indigenous, or people of color are less likely to be screened, less likely to be treated, and less likely to find resources that perhaps represent their cultural or linguistic background. We have really stark statistics that maternal mortality rate for Black mothers is 3 times the rate than that of white mothers. We also know that for Indigenous folks, the rates are similar or even higher. And we also know that particular parts of the country or parts of our state have very significantly different rates due to access of care, especially as we are thinking about maternity deserts. So what has this meant for Perigee from 2019 to today? So I want to just ground us a little bit in some high level, and these are both national as well as some state changes. So back in 2017, 2018, maternal mental health, and again, I'll speak about infant and early childhood mental health because it's something that is like core to who we are. But maternal mental health and infant early child mental health were rarely mentioned in state or federal policy conversations. And now we are happy to say that over 40 states, as well as very different and increasing number of national strategy and budget proposals have now named maternal mental health and infant and early childhood mental health. So I think that is a celebration for all of us, that some things have changed and that the acknowledgement of perinatal and maternal mental health is something that is at least being talked about, mentioned, and now showing up in different national and state uh, conversations. There were no federal maternal mental health hotlines that existed back in 2017, 2018, and now there's a national 24/7 hotline launched. We also know that Washington has a very strong warm line, and I know Victoria is going to speak to more of that. Only 7 states had perinatal psychiatry access program, and now 29 states offer programs that improve care through provider consultation and training. And Jamie at UW will speak more about that work here in Washington State. And there's a limited field recognition of the racial and cultural diversity in maternal mental health. And I'm happy to say that there is an increased acknowledgement, but also funding at both the philanthropic as well as public streams of funding that are supporting not only the recognition and more research, but also workforce development for cultural diversity to grow to support maternal health. Community-rooted models were underfunded and overlooked back in 2017 and 2018. I will say that this is still a body of work that needs more uplifting, but it is exciting to see that a lot of BIPOC-led models are becoming more visible, funded, and they are influencing policy and practice change. One wonderful example here in Washington State was the doula reimbursement process, which ended up being a national model for other states to follow as well. And the state level wins that were isolated and under-resourced, especially in maternal mental health. And now it's, as I mentioned, the doula reimbursement, but Washington is recognized as a national leader in the Medicaid postpartum 12-month expansion, the doula reimbursement, and the way that some of the infant and maternal mental health is starting to come together in healthcare practices. So that is a very high level then and now, and just to say that in 7 years, we as a country and as international community have experienced the effects of COVID. And I think that was one of the forcing mechanisms for a lot of these significant changes, especially around the acknowledgement of mental health, perinatal mental health, in that early, the early foundations and how the mental health of adults and caregivers and sort of our communities can really have longstanding effects. So at the national level, so I'll give some high level overview of who some of these folks are, and then I'll move more specifically into the Washington State folks. So some national work. So the Lifeline for Moms, as I spoke, there are 29 states who have some type of psychiatric consultation line. And so the Lifeline for Moms is a collaborating body for those states to come together and talk amongst each other to figure out how to improve each one of their state programs and also to help other states who are looking to create their consultation programs. We have a project in Rhode Island that's a collaborative care model, really bringing the OBGYNs into the conversation. As many of you who are on this call who work in this space, you know that the silos are real, especially in the healthcare component, knowing that primary care, OBGYN, behavioral health, like they still don't have a good way to come together and really support a person in that journey. It's still pretty fragmented. And so the Rhode Island folks are really testing a model where all of those different practices come together and offer a different type of model of care. We also work with the Maternal Mental Health Leadership Alliance. They're a big national policy group who is working both on the national front, but taking learnings from different states. So the Washington postpartum Medicaid expansion was a wonderful example where they were able to take that and really help equip other states and push for that national approach. We also have the Policy Center for Maternal Mental Health. If um, folks don't know this org, they rolled out a report card for states, which was really fascinating and interesting to see where every state stood and what were the different components and areas that they were stronger in or where they had more areas for growth. So I encourage you all to look at that. It's some really interesting data for us to think about, especially as you perhaps think about your particular region or part of the state and how you're thinking about perinatal mental health. Mama Turtle Village is an organization, a community-based organization in DC who is thinking about creative ways of workforce development and braiding public streams. And so we're hoping to share more as like a concept of how to think about perinatal mental health and include community workforces to do some of that behavioral and mental health work that oftentimes is reserved for more clinical models. I think they're really testing on like what is possible from a community standpoint or a community workforce standpoint. La Cocina is an organization out of Colorado who's really leading the Latino and immigrant maternal mental health process, especially in this moment of like, how do we think about perinatal mental health for the immigrant population, specifically the Latino population in this current moment in time. So if you're working with predominantly Latino communities, I would say I would recommend to look to some of the work that they're doing, especially around, again, community workforces, dignity work, and how to bring communities to care when they don't feel like a lot of traditional healthcare systems are safe for them. The Perinatal Support International, so that is an international organization that has state chapters, and Victoria here is representing some of PSWA's work, and we'll speak a little bit more to the work here in Washington. The Health Connect one is a national doula organization who is really helping states think about how to support their doulas, integrating into healthcare systems, but also how to build a national coalition to ensure that that workforce is getting the support that they need over the years as policies and reimbursements and so forth change. Shades of Blue is a national advocacy organization as well as doing some direct service. They focus predominantly with Black moms and Black dads in the birthing experience, regardless of the results. So that means folks who have had a stillbirth and who experience different maternal mental health experience based on their birthing experience. And in Washington State, so because Perigee is in Washington State, and this is where we started, we have much deeper grant making here that spans the 7 years and some even longer because our founder was making some grants before Perigee as an organization existed. Some of our grantees in the community approaches and workforce development are PSWA, which Victoria will share a little bit more about, Shades of Motherhood, who is in the Spokane area. And they are doing so many different things from training medical providers on how to support Black patients, doing workforce development, doula training. They're doing a lot of medical school education, really starting earlier to help students understand what does perinatal mental health look like and how does that show up differently for different populations. They're also doing a lot of work in fatherhood work. Open Arms is really an important birth equity organization in the King County and Pierce County, providing doula, peer support, lactation services. The Center for Indigenous Midwifery is working to train more Indigenous midwives and to do more work in rural areas and in Indigenous tribes. The Community Health Worker Coalition for Migrant and Refugees is an organization that it has built a perinatal community health worker model. It's called Caminando Juntos, specifically for Latino, migrant, and refugee populations here in the state of Washington. They are really pushing against the model that community health workers belong in community health centers and actually saying no, community health workers belong in communities. And so this model has been going on for about 3 years, the Caminando Juntos. And again, if you are working with migrant and refugee Latino families, and would be interested in learning more about a community health worker model, I'm happy to embed the links for each one of these organizations in their work, and Danny can share that out with the rest of you all if you're interested. There's the Tatawak Birds Justice Center in the Yakima area. They are bringing back a lot of their ancestral birthing practices and supporting their community members, especially as they face more chronic maternity care deserts, and connecting them to further mental health supports that are beyond their community if their patients need something more intensive and that requires more behavioral health treatment. The Hummingbird Indigenous Services, they are on this side, on the western side of the mountain, and they are also our guaranteed basic income partner. So Perigee started this about a year ago, providing guaranteed basic income to pregnant folks for 3 years, really thinking about chronic stress that happens, especially for pregnant folks, and all of the economic impact that there is on families when having a new baby, whether that's formula, diapers, buying all the necessary, equipment if needed to have the baby, whether it's a car seat or a crib or so forth. So definitely look to them. They are starting to roll out the beginning or the first round of data from what they're seeing in families. On the behavioral health and healthcare integration, the UW Perk Center, which Jamie will talk more about. There's a perinatal and infant mental health team now at the Healthcare Authority. So this has been a huge win for us. About 3 years that we've had a team who's really thinking about perinatal and infant mental health from both a reimbursement and policy advocacy standpoint. And from a policy and systems place, a postpartum Medicaid expansion, as we talked about, as well as Moms Rising here on the ground, who's really helping us think about different policy advocacy that needs to happen at the state level. And lastly, our cash and cash equivalent benefits Perigee was a big partner to the Employment Security Department on the Paid Family and Medical Leave Program. We did an initiative in Pierce and Yakima County, helping families know that they have access and help them apply to benefits for paid family and medical leave. And the state saw a significant increase in bonding leave in both of those two counties, especially for Latino folks, Black folks, Indigenous folks, veterans, and fathers. So again, as we think about these concentric circles that support folks, cash and cash equivalents are pretty important as we think about stressors that impact that opportunity to really focus on bonding. So that was a lot of information. Again, I'm happy to upload the links for these particular organizations and the models that they are, either growing or implementing in their communities as we think about, again, the community aspect as well as the systems aspect. So with that, thank you very much, and I'll pass it back to Danny.
Thank you so much, Marielle. I appreciate it so much. That's incredible information. The work that you're doing, that the Perigee Fund is doing, is just phenomenal. We do have time and can pause for any questions that folks might have about this presentation and the content that was shared. Feel free to put those questions in the chat or use the raise hand function, or just go ahead and unmute. Okay, well, we will keep rolling, but if you do think of something, Marielle's happy, I'm sure, to field emails or connect afterwards, or if something kind of percolates throughout the course of the presentations that maybe you have a question for all the presenters, we'll have some time at the very end for that as well. So I will go ahead and introduce our next presenters. I am incredibly excited. You just heard a little bit about both of these organizations. So I get to introduce Jamie and Victoria. Jamie Adachi leads the administration of the Perinatal Mental Health and Substance Use Education, Research and Clinical Consultation, or also known as PERC Center in the University of Washington Department of Psychiatry and Behavioral Sciences. Jamie focuses on the strategic growth of the center's workforce development, clinical consultation, and research initiatives aimed at improving care for perinatal mental health and substance use disorders locally and beyond. Her leadership has supported the development and expansion of key programs, including the UW MAP ECHO Perinatal Psychiatry Case Conference Series, the Perinatal Psychiatry Consultation Line for Providers, and the Perinatal Telepsychiatry Line Clinic. When not working to strengthen systems of care, Jamie can usually be found chasing or being chased by her two spirited toddlers. And Jamie will also be joined by Victoria Cherniak. Victoria is a people-centered nonprofit leader with over 17 years of experience. Victoria has worked in the perinatal space for 15 years, first as a postpartum doula and then at Perinatal Support Washington since 2018, where she is the senior program manager of the Perinatal Support Warm Line. Besides managing and expanding the program, she trains and supervises all who answer the line, which includes staff, MSW interns, and peer volunteers, on perinatal mental health, other issues affecting parents, and peer support skills, and helping design their 24-hour warm line peer training, and leads a majority of that training. Victoria has also become involved with Postpartum Support International in a volunteer capacity. Since 2020, she has facilitated their queer and trans parent support group. And since 2021, she has been a member of Postpartum Support International's Best Practices Committee for Perinatal Mental Health Equity. She has presented on topics around peer support in the perinatal space and serving LGBTQI+ parents. Victoria lives in Seattle with her youngest teen, as her oldest has flown the coop to chase her dreams of becoming a nurse. Victoria enjoys spending time with her family and friends over good food, dreams of road trips, traveling, and summer when she can be out in the woods. So with that, I will hand it over to you all to share your screen and the information. Thank you so much for being here.
Thank you, Danny, for introducing us. I'm gonna try to share my screen here. Give me a half a second. Let me know when you see purple. Great. Appreciate it. Okay. Hi, everyone. I am so thrilled to be here. I honestly, I wish we were all in a room together physically to be able to like see your faces but this is good because I'm in Tacoma and it's nice to connect with people across the state. So I'm Jamie. As Danny said, I'm a mom of a 3-year-old and a 1.5-year-old. And it is a wild journey, parenthood, and it has made me appreciate my job so much more. I started with the UW Perk Center back in 2019, before we were a center, before we were a program. We were just kind of offering some services, and we kind of have started to build and get more established in these last years. Let's see, I serve as the manager. I oversee all of the efforts of the center, and I work with a wonderful team of perinatal psychiatrists, like the best people you will ever meet, and also navigators and researchers, all with this common goal of helping to improve access to care for perinatal people with their mental health and co-occurring substance use disorders with no wrong door. That's been our theme lately, just like how do we break down walls and build doors and bridges, and that's where we're at right now. Let me move this forward. So I want to understand what's happening in your community. You can either like think about it and the thoughts can stay in your head, you could type it, or you could say it out loud, which is even better. But I want to understand what's happening in your community, what's going well regarding perinatal mental health and substance use disorders in your setting. So that could be maybe you work at a clinic, maybe you work at a nonprofit organization. Can you think about it? And if there's silence, I want people like Danny and Anna to be able to speak to that. Help me understand the landscape.
Jamie, I can share some of the things that are coming through in the chat.
Please do.
So, one person shared that something that's going well is it is finally being talked about.
That's powerful. Yeah. Angie, where do you work?
I work at Greater Health now. I know that in our community, you don't see a lot of that discussion happening quite yet. We're very rural, and so it's really just for me, it's nice to start hearing this as a mom as well. At one point, needing access to those resources and being surrounded by other parents. So I'm really excited that we're all here having these conversations to learn about these really valuable resources in the conversation.
So I'm hearing that there might be a need for some awareness building just around the topic and okay. Anybody else before I move on to my second question?
Camille
Offering.
shared that they are offering grocery gift cards and baby supplies mailed straight to clients' doors as an incentive to engage in our programming, which includes virtual wraparound basic need and perinatal SUD resource navigation.
That's great. Meeting people where they're at so they don't have to travel to try to find resources. I'm guessing the rural nature of things makes it difficult to get to places. Offering more trainings, stigma around substance use, lack of. That's helpful. Thank you for sharing, everyone. Um, I've heard a bit about barriers, like stigma, um, maybe lack of resources, anything else, hardship of COVID and COVID's impact. Culturally appropriate care.
Amy, I'm gonna, as a former neonatal ICU nurse that worked with this population well, I think a lot of providers are just uncomfortable with having conversations with moms around the impacts of substance use, whether it's prescribed or not. And so working with our providers on education is going to be really important.
That's really helpful. I could see how it could be uncomfortable. Because like, what do you do if you learn about something? Let's talk about what change you would make to improve the state of care there. Long wait lists, more training, anything else? More education. Okay. I'm reading the chat. Increase beds for women as men have more beds. Why do men have more beds? Okay. That's all helpful. Thank you. So I wanted to talk about our center and what we do. So really what we're focusing on is no wrong door. We're focused on building bridges and bridges between mental health and physical health, bridges between mental health and substance use care, because we know they're kind of two separate pathways for people that they have to navigate both. And there's many times co-occurring things happening, mental health and substance use, and bridging infant mental health and perinatal mental health, and bridging community to healthcare systems, because there's often a disconnect there or no bridges there. And focusing on kind of duplicating my perinatal psychiatrist brain and getting them out, get that knowledge out there to be able to help more people through a few different things. So firstly, we're focusing on expanding access to specialty perinatal mental health and substance use care through a few different ways. So we have a telepsychiatry clinic, which is available to patients across the state. I'll talk more about that later, but yeah, so you could take appointments from your home and talk to one of our psychiatrists with this unique specialty. And we also have an in-person clinic, which is less relevant to you all because that would be a long drive. And we have a consultation line for providers. Any provider in the state, it could be a doula, community health worker, OB can call about their patient if they're concerned and receive recommendations. And I will talk more about that soon. We also focus on training the workforce, provider workforce, the people who are at the front line, seeing pregnant people, seeing postpartum people, and helping them feel more confident to help their patients in this way. So one of the ways we do that is through a training series called Map Echo, and I will talk more about that soon. And we also mentor and train resident trainees regularly. Our third pillar focuses on our research efforts, evaluation efforts, and disseminating what we're learning out there. So I'd like to highlight our technical assistance. So we're working with healthcare systems to build workflows and programs to kind of help their perinatal populations receive mental health and substance use care. So we're doing that within our own system at UW and also through a few different FQHCs in the Seattle area. And that has been super interesting, not easy work, but it's been very fulfilling and with a lot of learning. So I'd like to highlight this program, Perinatal PCL is what we call it. This is our consultation line. Basically, you call, any provider in Washington can call. And these are the questions that you can ask about. We have a new feature where you could sign up for a slot if you prefer, if you don't like to keep your schedule squishy, you could sign up for a spot and you can either talk to a perinatal psychiatrist or someone with perinatal psychiatry and addiction specialty. So that's like a new offering within the last couple of years or so. We found a perinatal addiction psychiatrist, which is a unicorn out there. Consultations are always free. You get an email which summarizes all the things that you talked about in the call. For example, like recommendations that are related to non-medication treatment, medication, and or resources. Yes, so the call is answered by the navigator. Most of the time, there's a direct connection to a psychiatrist, and then there's a remainder within 2 to 3 hours, and then clinical recommendations. We'll not go into that because I'm looking at my time here. But as you can see here, we have a diverse array of callers. So no need to feel like you're not a doctor, so don't call. So anybody can call and get these recommendations. And this is what our data looks like. And we have reached most of the Washington state counties. If you know anyone in Garfield, or I don't even know how to pronounce that other one, Waukegan, please have them call us because we can fill out the map. And as part of our education efforts, we develop a care guide that we keep related to different conditions like ADHD, PTSD, etc., that you can look through. And there's some nice treatment algorithms that kind of help to guide providers on like what to do, like how to screen, what to do if someone screens positive, and it helps to just triage patients through to figure out what they need. And some medication summaries. Next, I want to highlight our telepsychiatry clinic. It launched as a result of the pandemic. We were seeing an increasing anxiety and depression and just stress related to the pandemic. People were isolated. And so this is staffed by our psychiatrists, and it's really set up to be more like a consultation model where a person can be seen once, but then we loop back to the referring provider to give them the recommendations. So it seeks to kind of give someone the care they need now, the patient, but then also empower the provider who referred them to kind of take on the treatment. And then if that feels overwhelming for the provider, they just call us and they're like, hey, I need advice about ABC, whatever it may be. This clinic is not for people who are imminently suicidal or in crisis, or experiencing like severe psychotic symptoms. And it's not for people who want ongoing treatment. It's more like a consultation, like an assessment. So I'd like to also highlight our provider training series. It's happening now. It's monthly, virtual, so you can tune in as you like. And here are our learning objectives, which I'm not gonna go over. You could read them. You can get continuing education credits. It's monthly, 1 hour, and open to all people who see perinatal patients. So the unique structure of this series is that it starts out with a didactic related to the topic. It could be, we've recently done one on lactation and medication. So the didactic is more just like learning, and then followed by a case presentation by someone in the community. So they're like, hey, I have this patient, they're suffering from this. This is what I've done. What do you think, community? So it's everybody kind of teaching everybody, which is fun. Checkpoint. Okay, I would love for people to put things in the chat. Okay, what would a truly integrated system look like in your community? I'm going to pause for longer than last time because it's like a big question. I know it's a big question. Yeah, just think about the system supporting perinatal mental health, like perinatal patients, and what it looks like now and what it maybe should look like or could look like if we think about it and put together resources. Case conferencing for those in need. Direct connections between perinatal care providers, psychiatrists, and mental health providers with warm handoffs. Training. Thank you for sharing, everyone. That sounds like a great world. Um, how do you see these services that I've mentioned, our telepsychiatry clinic, our MAP Echo series, consultation line, how do you see them complementing what you have? Or are we not in a place where we're aware of what we have yet? More common spaces to come together. Well, Greater Health Now seems to be facilitating great connections already. Okay. And barriers. Are there barriers to accessing these resources other than just like awareness that they exist? Okay. Thanks, Alma. I'm happy to do this presentation again to other groups. So that was my presentation, and we're always looking for more collaborators to kind of expand our reach to communities, especially in your part of the state. I'm happy to do this presentation and other like staff meetings. I know Victoria said the same thing about hers, and um, we are also, I should mention, I know this is I'm not sure if patients in your community get care at UW, like prenatal care or give birth, but I'm thinking that the higher risk people might. Um, so if there's anyone who is interested in being an advisory board member for one of our projects, we're looking for people who received prenatal or care at UW Medicine within the last few years and experienced mental health or substance use concerns within that time frame, and they're comfortable sharing their story. We're looking for an advisory board that has a lived experience. So they're welcome to reach out to me. There is a payment via gift cards offered for that. Any questions before I pass the mic over to Victoria?
All right. Well, I will jump in. I just want to share that PSWA and especially the Warm Line are big fans of Perk and users as well. Really, the whole any provider is very true. Our Warm Line, we're peers, and we get to call and talk to either the navigator or the perinatal psychiatrist on duty, and it's such, I don't know, the buffer is not the right word. It's so helpful for the work that we do and getting the support to parents. And so just want to shout y'all out, Jamie.
We're fans too, Victoria.
Um, so so I'm really excited to be here today to talk about PSWA. Just real briefly, as you heard, my kids are older, but the perinatal period is always very close to me, not just because of the work I do, but it's what my kids and being in having a lived experience of a perinatal mental health issue led me to be a doula, which then led me into the work at Perinatal Support Washington. So um, I love talking about this issue. It's very dear to my heart. So hopefully I won't have to go on. I won't go on and on, but I do, this is the my passion work. So So I'm going to talk about Perinatal Support Washington today. Our mission is to shine a light on perinatal mental health and to strengthen all families and communities. So we serve all of Washington State. These four things listed is kind of like what we do. We do a lot of awareness around perinatal mental health, and we educate professionals, really anybody who is going to interact with parents in the perinatal period. For us, the perinatal period is anywhere from trying to conceive to 2 years postpartum-ish. And then we have three direct service programs as well that we do. So before I talk about what we do at PSY, I want to talk about the transition to parenthood because it feels very central to who we are at Perinatal Support Washington. Most of our staff are parents with lived experience. And there's something that happens that leads us to have perinatal mental health issues. And I think like the transition to parenthood is one of those. And so wondering if y'all would shout out or you could put in the chat. I'm really bad at multitasking, but I think I might be able to, somebody could like read out the chat, or if y'all want to shout out, why do you think the transition to parenthood is so hard? Life drastically changes, totally. No sleep, hormonal changes. Yes. Kids don't come with a manual or money, because you don't know if you're going to be a good parent. I could spend all day on this, but most is sleep and scheduling. These are so great, right? So if you more are coming, this is awesome. So check it out. Um, you know, welcoming a new baby into your family is a very exciting time, but it's also very complex, right? With that joy comes the sleepless nights. We're caring for a tiny human. It's more than a full-time job, and it's emotional, it's physical, and it's hard work. And that is really a lot. And becoming a parent is transformative, right? We change through this experience. We're adding a new person into our family. And because of that, we're adding a new person into our relationship with our partner, in relationship to ourselves, right? Like our identity really changes and everything resets because of this tiny human. So it's also a time of contrast, right? Like there's lots of joy, but also there's very serious challenges, and it really upends our lives in profound ways. And I think parenting can be a love-hate relationship, and in our society, holding those two things at the same time, like love and hate, like we don't do that very well, and we don't make space for that with parents, and especially with new parents. So oftentimes parents feel like, oh, having a baby is supposed to be all joy. And if I feel anything like I hate this, like I hated being a nighttime parent. I was horrible at nighttime. I was like, why did I do this? Even though I tried for 2 years to have my kid. And I literally, like, it wasn't a joke. I was like, why did I do this to myself? And those are really hard things to square within yourself when the world doesn't let you talk about them, right? Like, I love my children fiercely, but there are times I do not like them. And that is a scary thing to say. People don't say that. And so it's kind of the how things become so hard for parents is because of those barriers that society has set up. Okay. Um, So where do these messages about parenting come from? So these are the systems at play. I won't really go into them, but just to point out that some of these can be helpful and hurtful, and they're largely unseen but very impactful. So when parents come into your office, these are the things swirling around their head that is impacting who they are as individuals and who they are as parents. So there's the personal and social, the systemic, and then the cultural messages and expectations. So in the US, there is cultural, systemic, and policy setup for parents. And we know that that policy setup is very broken. It does not help parents. So this slide is an example of just one policy impacting parents in the US. This is paid maternity leave, comparing the US to other countries. Um, and then this is paid paternity leave, comparing the US to other countries. So obviously the US is at zero. I think we would find similar setups for the United States versus other countries on other policy issues that heavily impact families. So let's think about childcare, about healthcare, and I'm sure there's more. So this just really is showing that there is a setup for failure, or at the very least, making parenting an uphill battle, depending on your access to resources, right? And this is all happening when it's really like the most vulnerable time, personally, right? Growing and caring for a tiny human. So one more question for y'all, if you want to put it in chat or shout it out. What are motherhood and parenting myths that are out in society? Um, and maybe, I mean, we all swim in our society, and so there are definitely things that impact us, even if we know they're a myth. But anybody got anything? Feel free to come off mute and shout out too. Bouncing back, right? Yeah, so you've had a baby and kind of supposed to be over it. Time to get back to work, time to do all the things. You can do it all for sure. We forget that raising children and having children was a village affair, right? And so we feel like we have to do it all ourselves. Um, let's see. Yes, you magically know everything about how to raise this person. So in the support group that I run, I will sometimes do how old of a parent are you check-in. So people have to say like, I'm a 1 week old parent. It's kind of a reminder, right? I think in social media, like um, there's so much information out there and people, I know I feel it, like I have to know it all, but we don't, and we can't possibly, right? If we're 1 week old. I'm a 15-year-old parent, and let me tell you, it's still really hard. Um, yeah, great. So just some other things, I think one thing, right, like mothers are the default parents. Fathers are not necessary for early infancy. We know that's a big fallacy. Men's brains change as well. And it's really, really important that they engage in those newborn months, because that's what makes their brain change. Um, Mothers are the experts on their babies. Mothers are always happy. Working mothers are neglectful. If you're taking time for yourself, um, you're being selfish. We must give all of ourselves to our children, right? So when we don't meet those expectations, when our reality is different than what we thought it would be, what we were told it would be, we internalize those things and we feel a lot of guilt and shame. We don't talk to our loved ones about it. Sometimes we won't even talk to our providers about it because we feel like it's a failure on our part. So some of the realities of parenting is, no paid maternity leave, having health issues or complications, financial strain, maternal pride. I can do it myself. Again, that's kind of what we're taught in this society. Everything is new. We're having to learn who we are. We're having to learn who our baby is. Um, our old ways of stress management are no longer available often, because everything is so upended and we're dealing, with fluctuating hormones. We're maybe helping a sibling adjust. We have now more body image issues, right? About how our body is postpartum. There's the invisible load of parenting and the expectations that we have on our partners and our partners have on us. It just goes on and on, right? It reshapes our relationships with our partners. I think I saw somebody write that in so very much, right? At every stage, during pregnancy, postpartum, after a loss. And so all these realities are a lot to deal with at once. And I know I don't think we talk about it enough. And I think that kind of leads us into um, where we end up with a lot of perinatal mental health issues. So one of the worst parts about the symptoms of postpartum depression and anxiety is that they don't feel like symptoms. They feel like who you are. So this quote rings very true. So I manage our warm line, and these are the things we hear from parents all the time. I know this was my experience um, as well. And so we, especially women, internalize these things, right? I'm a bad mom. My baby would be better off without me. I'm useless to my family. Maybe I wasn't meant to be a mother. So these are the things that we hear from parents. And this is a really hard reality of having a perinatal mental health issues because really at your core, it feels like who you are. We forget that it's symptoms. It's a symptom of a perinatal mental health issue. It's a symptom of us, of our policies that don't support families. It's a symptom of racism and oppression that really put added stress on families. So Perinatal Support Washington, in two of our direct service programs, we use peer support. And it goes back to the founding of our organization, where over 35 years ago, a group of parents started Perinatal Support Washington so that no longer would new parents not have a place to turn. So I like to talk about peer support because it is very much grounded in who we were and who we are today. So peer support is someone who has a lived experience, in this case with perinatal mental health issues. So if somebody calls the warm line, they're going to talk to a peer, a parent who has had a perinatal mental health issue and is on the other side, or, along that journey of healing. And peer support is super, super powerful. It it can include emotional support. It can include talking about wellness planning and self-care. And talking to somebody who's on the other side can really offer that perspective and that hope to the parent who is calling in or receiving those services. They are providing proof that when you're in it, because when you're in it, it feels like a pit and it feels like this is the new you and this is how it's always going to be. And talking to somebody who is on the other side is just an amazing perspective to have. And it's also telling you you're not alone. So many of the parents who call us feel like they are alone. They feel like they're the only one who's experienced this, which is shocking in 2025, but it's so true. And we're often the first person that they have told that they felt safe to tell. And peer support is evidence-based. It's super effective, and it's kind of for all these reasons here. It increases social support and participation in people's communities. It reduces symptoms and improves well-being. People who are getting peer support get treatment faster, and it encourages more thorough and longer lasting recoveries. So why do we do peer support at PSWA? So here's our staff. We had a staff retreat in June. We are spread out all over the state. So we flew some people in, and people drove from afar, and we met together, which was a lovely opportunity. But we do peer support at PSWA really because of everything that I've talked about so far, and our other presenters, right? The transition to parenthood is hard. No, I don't know anybody who's had an easy transition, right? Like it is hard. And so we're here for that. The other thing is peer support is preventative. So you don't have to have a mental health issue to come and talk to PSWA, to call the warm line. Again, parenting is hard. We are here for all of it. We really see our work as preventative. We also view as parents being the expert in their own lives, and they are the guides on how to support them. So we are very parent-led. when we work with a parent, if they're ready to talk solutions, we're going to ask them questions. We don't tell people like, this is what you should do. We really work with parents to develop that plan. So now I'm going to talk about some of our services at PSWA. So here's our warm line staff. Again, at our staff retreat, there's more than just the people there. We have right now 6 MSW interns and over 30 volunteers. So that's missing from this picture. So here's some logistics about the warm line. The warm line can be reached via text, phone call, email. U.S. providers can fill out a referral form on behalf of a parent with their permission and refer them to us, and we will reach out. We really want to have as little barriers as possible for people to reach us. So the warm line is answered live during weekday business hours in English and Spanish. So we do have a Spanish warm line. And then for other languages, we provide interpreters. We don't want to leave parents hanging. So for evenings and weekends, we have volunteers that cover those shifts. So we're not live answering. Calls will go to voicemail, and then volunteers will call them back within 14 hours. Usually it's much quicker than that. Anyone can reach out to the warm line. So parents reach out to us, family members. We get lots of calls from grandparents. We get calls from friends, providers. You all can call us if you have questions about how to refer to us or a resource or need some information on perinatal mental health. And we also support dads too, right? So leaving dads out of this would be a huge problem because dads are like almost 50% of the perinatal equation, of the parent equation. So we have a dad, he's the tall one right there, who's our peer specialist on the warm line. And he offers peer support. And so dads can call and speak to anybody, but if they want to talk to another dad, they can request him. So what does peer support look like on the warm line? So what happens in initial call is we really hold space for people. So we are giving them a lot of space to say all the things they haven't been able to say. So we're offering emotional support. If a parent wants to, we'll do some self-care and wellness planning. So oftentimes they'll talk about maybe how isolated they feel, right? Isolation is a big issue in the perinatal period, definitely a precursor of perinatal mental health. So maybe we'll talk with them about, how they can break that isolation, or we'll hear that they're not sleeping. That's a big issue, right? And so we can talk about those kinds of things with them. And we do this because we know that sometimes even like small things like taking care of yourself can really impact somebody's mental health. So the other thing that we do is we have lots of parents who call us who've gotten a list from an OB or another provider with like 10 or 20 therapists, and they've called all of them, and either people haven't gotten back or they're all filled. And I've listened to voicemails where somebody was like, I've called 20, she was crying, I've called 20 people. And just the desperation, right? Because there goes that thing of like 75% of people don't get treatment. And so she called us, and we provide targeted referrals. So we will not give out a name of a therapist or a med prescriber unless we know they take their insurance and have openings. And that is really a huge service because I know I had to find a therapist for my teen, and I'm, pretty much in my right mind. I'm not like sleep deprived. I don't have a new baby, and that was a lot of work, and it was daunting. And I just can't imagine having to do that, in the postpartum period. So we do that legwork so that parents won't fall through the cracks, and so that we can hope that more than 25% of people are getting treatment that they need. So the warm line is more than an initial call. So it's not just one call, which makes us really different than a lot of other lines. So after a call, we will send an email with anything that we discuss. So if we did any wellness planning, we'll write it down. Um, Again, like having something tangible, I think is really helpful because it's hard to focus and remember all the things. And so we'll send the resources in there. We'll also give the number of the peer that they spoke to so that if they need to talk again, they don't have to call back the warm line and they can reach out to the peer. And then we do a 1 week check-in. So we always call parents back. The same peer does that, checks in about how things are going, if there's anything new happening, how did the wellness planning go, if they did any, um, how are the resources? Were they able to reach out? Are they having, is something stopping them from reaching out? Like, what more can we do? At the 1 week check-in, we always ask parents if they want to stay connected to that peer. Usually it's the same peer and do what we call extended peer support. And that can go up to, we say 3 months-ish. It sometimes goes longer. It's really dependent on what a parent needs. And it's really more of the same. It's kind of a mentorship relationship, but it's nice because we can really, if they want to do wellness plan, dig more into that. And then our goal is to really help build social support networks so that they have, so that when we pull back, they have developed the support that they need. So here's a list of the top 10 issues that were reported on first calls with parents. Um, so obviously anxiety and depression are our biggest ones, but parents really call us for all sorts of reasons, right? This is so hard. I don't feel bonded to my baby. I'm so tired. Breastfeeding isn't going well. I mean, it's really it's the whole gamut. Um, and then I um, just to give you an example, last week we had a nurse call from a hospital who had a mom on her floor who had just had a stillbirth and was wondering how to refer to us. So she referred to us, and we had a volunteer reach out to that mom while she was still in the hospital to offer emotional support and give resources. And then we're later able to connect her with one of our peers who had a loss experience. So when people want to talk to somebody with a similar experience, like a loss or birth trauma or NICU stay, we do our best to match that with our peers. It depends on availability, but those are things that we try and do. So we know that not everyone will feel comfortable reaching out to a warm line. And that might be especially true for dads. So our dad specialist started a support group well over a year ago. And our support group is weekly. When we started it, it was once a month, but it was so popular that, there wasn't enough time for everybody to speak. So we made it weekly. Still very popular. We get anywhere from 8 to 12 dads a week. It's a drop-in group, and Nathan's really cultivating a space where dads can talk about the true things about being a dad and build that community. I think which he often talks about when parents, have a child, it's, there's grief in it for, I think, both parents, but for dads, they're often losing their best friend because they can't lean on their best friend the way they used to, right? Because she's busy. And so it's really important to build those connections with other men. So we have that group. And then some of our other programs, we have our clinical therapy program, which is statewide, and it's telehealth therapy. We use interns and externs and staff therapists to provide the therapy. Here's a list of the insurances that we take. We do have spaces available right now for those with Medicaid. And sometimes we are able to fit in people for free and sliding scale spots as well. If you're wondering how to refer to us, I will post a link that takes you to our referral form you can fill out. You can always call the warm line. We also, like at our organization, is like no wrong door. The warm line is probably the best entryway to come in because we can then refer to the therapy program as well. We have a provider directory on our website. And it includes therapists, includes support groups and doulas. And in order to get on our website, you have to apply because we want to make sure people have training and experience in perinatal mental health. We do a lot of trainings across the state. So here are some of our regular offerings. Our 1 day and 2 day foundational trainings in perinatal mental health are free due to a grant from or a contract from DCYF. We do support group facilitation training twice a year, so in the spring and fall. And then anybody who attends that can attend a monthly consultation group forever. Um, and then we also have quarterly webinars on specialized topics. We've had ones on dads, Indigenous women, LGBTQ families, supporting neurodivergent parents, and more. And they are on our website, and you can go watch them for free. They're all like an hour and a half, I believe. Here's our materials that you can get on our website and download. The warm line flyer, which is in the middle, and then what we call the postcard where it says need help, those are translated into 20, I think 28 languages on our website. And then here's what I posted in the link. And then just a quote from a warm line caller. Just want to say that we can come and do this presentation. We also have started doing presentations to people who are screening about how to connect with parents and build rapport and do screening as well. So we're happy to come out and do that um, to staff meetings, whatever. Just let me know what you'd like. We're really big focus is trying to reach out to the east side of the state. And our outreach manager, Karina, has worked probably with a number of you through our work. But yeah, if there's any questions, and that's my contact information.
Thank you so much, Victoria and Jamie. That was just so many resources available. That's incredible. I'm just so grateful to your organizations on behalf of, all of our moms and dads and grandparents and providers and all of the above. So, any questions for Victoria or Jamie?
I have a quick question. Victoria, are you seeing a need for grandparents who are parenting to get some warm line support?
Um, we've definitely had all caregivers call us, but I would say mostly it's been grandparents who are concerned about their children. So, we've gotten a number of calls like worried about that their daughter or their daughter-in-law or their son is having postpartum depression and how to help. But we are open for all caregivers, in the perinatal period. So, who are having babies and caring for babies. Yeah.
Wonderful, thank you.
Mhm.
Okay, well, we will keep rolling. Thank you again so much. And we will have some time likely at the end if you have any questions come up, or these slides will be shared with the contact information embedded. So you can always reach out later if something comes to mind, or you have an opportunity to, cascade this information and want to invite Victoria, Jamie, or Marielle, or Alma to present with your group. So, and with that, I am excited to introduce you to Alma. Alma Peña Taveras is, oops, sorry, let me get oriented here, is a first generation Mexican American born and raised in Pasco and a passionate advocate for birth and postpartum equity. She has a degree in public health and global health from the University of Washington and recently completed birth doula training through the Center for Indigenous Midwifery. Alma champions maternal mental health, facilitates parent support groups, and leads the Perinatal Collaborative of Benton and Franklin counties to strengthen family support systems. And with that, I will hand it over to you, Alma.
Yeah, thank you so much. Good morning, everyone. I'm happy to be here. As you all know, supporting the mental health of expecting and new parents truly takes a village. So, doulas, medical providers, social workers, early learning providers, everyone plays a role in helping families feel supported and connected to the right resources during such an important life transition. So, I'm excited to share how the Perinatal Collaborative of Benton and Franklin counties is supporting perinatal mental health in our community, and along with some resources you can share with the families that you serve. Next slide, please. Yeah, so I'd like to start by introducing the Perinatal Collaborative of Benton and Franklin counties. For those who aren't familiar, this collaborative was launched by the Benton Franklin Health District in 2023 to improve care for mothers and babies and strengthen partnerships during the perinatal period, which is that pregnancy through a child's first birthday. And the collaborative creates a space where providers and community organizations can educate, connect, collaborate, and share resources while focusing on improving outcomes across our bi-county area. So meetings are held virtually every month on the second Thursday at 11 a.m., and any professional that supports families during the perinatal period is welcome to join. The collaborative includes a wide range of agencies and perinatal professionals ranging from nurses, midwives, dietitians, hospital providers, and social workers, and so many more. The more voices and perspectives that we have participating in the collaborative, the better we can support healthy outcomes for families. So think of the Perinatal Collaborative as a go-to resource for providers and organizations that serve families in Benton and Franklin counties. Next slide, please. So, as we've learned today, perinatal mental health is a significant public health concern, both statewide and here in our region. So, the Pregnancy Risk Assessment Monitoring System, also known as PRAMS, is a survey of new mothers conducted by the Washington State Department of Health and the CDC, and it collects information about mothers' experiences before, during, and after their most recent pregnancy. So, according to PRAM's data from years 2021 to 2023, postpartum people in Benton and Franklin counties report higher rates of anxiety and depression before pregnancy compared to the state average. We're also seeing higher percentages of people who say they always or often feel down, depressed, or hopeless after giving birth. All of this reinforces why our collaborative's work is so important. Families in our region are facing real and growing needs, and by strengthening screening, awareness, and access to local mental health support, we can meaningfully improve the well being of parents, babies, and just entire families. Next slide, please. So, looking at both our local and state data, again, it's clear that our community needs stronger support around perinatal mental health. So, in 2024, the Perinatal Collaborative decided to take action, and we applied for and received a grant focused on increasing knowledge and awareness of perinatal mood and anxiety disorders here in our counties. So, a big shout out to DCYF and Perinatal Support Washington for the opportunity. This grant helped us expand local supports and improve our community's ability to connect parents to resources. The Perinatal Collaborative of Benton and Franklin counties stepped in as our perinatal mental health task force, and they helped us set priorities and guide the work. So, with this grant, we were able to launch several key initiatives such as peer support groups to give parents a safe and understanding space to share their experiences, a resource and referral guide to help families and providers quickly find local support, and a 1-day perinatal mood and anxiety disorders training to build shared understanding and confidence across our perinatal workforce. So these efforts were important first steps in addressing gaps, again, in screening and awareness and access to care. So next, I'll walk you through a little bit more on each of these. And you can move on to the next slide, please. Perfect. So yeah, I know Victoria touched a lot on peer support, but research consistently shows that peer support and community connection play a major role in supporting mental health during pregnancy and the postpartum period. So when parents feel supported and connected, both their well-being and their baby's well-being improves. So with the grant support, we were able to launch 2 free drop-in parent support groups in March of 2025 So one was in English and one is in Spanish. And these groups were hosted at the Pasco Public Library throughout the year. And beginning in 2026, we'll be actually transitioning to a new location. It might be Kennewick, but not sure yet. But definitely the updated meeting times and dates will be available on the Health District's website, and it also will be shared with the Perinatal Collaborative very soon. The support groups are intended to reduce isolation, build community, and strengthen peer support for anyone in Benton and Franklin counties who is going through pregnancy or postpartum. So these groups are currently being co-facilitated by a local bilingual mom and myself. And again, thank you to the grant. We completed a group peer support facilitator training that equipped us to create a trauma-informed, equitable, and respectful environment. So we designed the groups to be safe and welcoming spaces where parents can connect and share their experiences and receive support without judgment. One of the most meaningful parts of these gatherings is how naturally parents share resources with one another, from community services to just personal advice. We also make sure families know about additional supports, including the Perinatal Support Washington Warm Line. And our long-term vision is for these groups to become more community-led and reflecting the voices and needs of the families who attend. And these groups may appear simple, but their impact is very powerful. They help parents feel less alone, foster connection, and strengthen perinatal mental health across our region. Next slide, please.
This space is a safe space for you to come in as you are. No need to put on any filters, makeup, whether you're a first-time mom or you've done this over and over again. Make the drive, get your child in the car seat and come on over, because it's 100% worth it. I feel like nowhere else in society you're given this opportunity to come and take care of you in such a raw manner. It really is healing, it's supportive, it's a godsend. So this space is...
Yeah, so we just saw there. Oh, I knew I was going to do that. But yeah, that was just a short clip from a mom that attended the support group, just talking about her experiences, encouraging other parents to join. And that video we have on the Health District's website. And also we share it on our social media, the Health District social media. So that way we can kind of help spread the word and yeah. Okay, so next I would like to just talk about another important part of the work, and that's been creating this local perinatal mental health resource and referral guide. The guide does have other resources, just because we do have a smaller amount of specifically perinatal mental health resources in our counties, but this guide helps connect parents with local services and supports, and it was developed with the help of the Perinatal Collaborative. So the guide is available on the Perinatal Support Washington webpage, as well as the Perinatal Collaborative webpage. And it's designed primarily for providers and professionals. However, it is easy for parents to access online as well. And looking ahead for next year, our goals are to update this guide more often, and also be able to make sure that more providers in our community are aware of this resource and are using it. And also, we will work on kind of improving just usability of this document. But yeah, next slide, please. So lastly, another key part of our grant funded work this year was partnering with Perinatal Support Washington to plan and offer the Foundations in Perinatal Mental Health training at no cost to perinatal professionals in Benton and Franklin counties. So this introductory training was designed for anyone who works with families. So having expertise in mental health was not a requirement. The training covered how to recognize signs and symptoms of perinatal mood and anxiety disorders, use screening tools, understand treatment options, and connect parents with appropriate resources. And we held this training virtually this year on March 26th with about 10 local professionals participating. So it was a strong first step towards building shared understanding across agencies that serve families. And we actually are currently in the planning stages of our next year's foundations training. And for that training, we are looking to host that sometime in March of 2026. And the focus will be on birth trauma and substance use disorders, which were two priority topics that were identified by the Perinatal Collaborative this year. And also, we are exploring options for offering like educational credits, including STARS hours for childcare providers. So, our goal is to increase participation and continue strengthening provider knowledge to better support families during the perinatal period. And if you would like to attend next year's training, please send me an email. That way, I can make sure that you get the registration details as soon as they are available. And my email is going to be in the next slide. Go ahead, Danny, to the next one. Awesome. So again, looking ahead, we have a few key priorities. So we plan to expand support groups locally across the Bi-County area, including in rural communities, and starting support groups for dads and non-birthing partners in our region. And we're also focused on strengthening partnerships with local family serving agencies and increase just parent engagement in general. So I'm also excited to share that the Perinatal Collaborative actually was awarded a new grant through the Washington State Perinatal Collaborative, which will help us support this work over the next 3 years. So it's super exciting. And our focus will remain on listening to our community and reducing stigma around perinatal health because meaningful change takes all of us. If you'd like to stay connected and receive updates on local perinatal mental health resources and training opportunities like the ones I shared today, again, please feel free to send me an email. I can add you to the Perinatal Collaborative email list. And our next meeting, actually, this month's meeting was canceled. But if you are interested in being part of the Perinatal Collaborative, then the next meeting will be on Thursday, January 8th at 11 a.m. And just make sure to keep an eye out for the new support group dates and times, which will be posted on our website soon. And next slide. I think that is the end. Yep. Thank you, everyone. Super short and sweet. Does anybody have any questions?
Thank you so much, Alma. We really appreciate it. Does anyone have any questions for Alma or for any of the presenters at this time before we roll into kind of our closing thoughts? All right. Well, thank you all so much. We really, really appreciate it. Thank you again to our presenters. We really are so, so appreciative of the incredible services your organizations offer and of the work that you do and the time that you put into presenting today. So thank you so very much. And as I mentioned briefly, I just wanted to let you all know that this is the first part of a two-part series. We will be talking more about perinatal care and maternal support in January on the 27th at 9 a.m. again. And the registration for that will be on our website on the Learning Collabs page. And we'll make sure to send it out specifically to this group as well when that opens so that you can join us to learn more about access to care in Southeast Washington, especially thinking about any maternal deserts and special initiatives that we have going on. So thank you again so much. I would really appreciate your feedback on today and your experience with the Learning Collaborative. Here is a QR code, and I will send the post survey link in. I'll put it in the chat here in just one moment, and then I will also include it in the follow-up email if you need to kind of think on your day. But it's just a quick survey, just asks a few quick questions. We'd love to hear how your experience was, if it aligned with your expectations, if you got some things out of it, and if you have any suggestions for future topics. So I'll leave this up here for just a moment. Lots of wonderful thank yous coming through in the chat. Thank you so much, everyone. And then one last, if you're looking for more educational opportunities around topics related to health in our region and well-being, definitely check out our website to see our podcast. You can also find it on Spotify or Apple Podcasts or wherever you're listening to podcasts these days by searching for Care and Consequence. And that is hosted by Sharon and Becky, our wonderful team leaders. And we'd love to have you check it out and hear more about the work that Greater Health Now is doing and things going on in our region. So, and with that, I will wrap up. I will share out my contact information as well when I share the slides, but I'm going to stop sharing and just say